welcome to our webinar in collaboration with TENI. Thanks in particular for Hannah for helping us to organize this event. We are here for around the next hour to answer your questions about Gender Plus, an independent gender service comprising of clinicians who have worked in NHS gender services either presently or in the past, and the Gender Plus Hormone Clinic, which is the associated prescribing service. We're coming together as an independent practice to offer timely, compassionate, evidence-based gender service to young people and adults. And thank you to everyone who has submitted a question ahead of this webinar. We will begin with some general, frequently asked questions. Then we will move on to those we have received in advance from participants. Also, please feel free to pop any questions you have in the box, and we will endeavour to answer as many of those as possible. For those we are unable to answer, we will draft a follow-up Q&A, which will be published on the Gender Plus website. We will also be recording this session, and we will share the link in due course so that you can watch this back at your leisure. So that's the housekeeping out of the way. So let's start with making some introductions. So I'm talking, so I'll go first. So my name is Aidan Kelly. I am a clinical psychologist and the director at Gender Plus. And I guess of relevance to kind of the Irish families, I suppose, is that I was also the clinician at Zitz, the Gender Identity Development Service that ran the Dublin outreach in Crumlin Children's Hospital for many years. So I am Irish myself, but also having kind of run that service for a number of years, the Irish outreach one, I kind of know the field quite well and the Irish kind of setting quite well too. I'll hand over to Claudia. Why don't you go next?
Hi, I'm Claudia Zitz. I'm a clinical psychologist and a family therapist at Gender Plus. In terms of my previous experience, I used to work in kids as well for about 10 years. And before that, I used to work in child and adolescent mental health services. And I hand over to Paul.
Thank you. Hi, everybody. I'm Paul. I'm a nurse consultant and I manage the Hormone Clinic. Previous to coming on to Gender Plus's books, I worked for nearly a decade at the gender service in the endocrine team at GIDS. And prior to that, I've worked in various jobs, including safeguarding and teenage sexual health. And whilst I was in the endocrine team, I also managed some of the paediatric services. So it's great to be here today. Thank you for having me. And we'll probably come on to it a little bit later. But I also work alongside Dr. Tomás Ahern, who is the endocrinologist that will be running the Dublin clinics. So I'm sure we'll come on to that shortly and explain that a little bit more. But whilst I've got the floor, shall we start with some questions? Aidan, would you like to give everybody a little bit of information about what we actually do at Gender Plus, what we can offer?
Sure. Thanks, Paul. So I guess we offer the full array of services that you would expect from a gender identity clinic. So including psychological assessment and support, we provide recommendations around hormonal treatments, and for adult patients, so those over 18, referrals for gender affirming surgeries. We also run a hormone clinic, which enables us to provide a fully integrated gender service. In addition, we offer LGBTQ+ informed mental health assessment and treatment services, as well as neurodevelopmental assessment and support services for those up to the age of 18.
Brilliant, thank you. I've got another question for you though, if that's all right. So I think everyone would probably be interested to know about our processes. So what would be the process when someone comes through to Gender Plus? I don't know if you could just sort of talk it through stage by stage.
Sure. So I guess there's probably been a realization or an acknowledgement at some point that someone's struggling with their gender identity and needs support, professional kind of support in relation to that. And so either attending a GP or a local kind of professional, or potentially going online and Googling gender identity services, but I guess somehow they will be directed towards our website. So www.genderplus.com. They land on the website and probably spend some time reading up about our service. And I guess coming to the point of deciding to book. And typically, the vast majority of people that book with us book for what's called a gender assessment, but some people do decide to do some therapy sessions first. But essentially, kind of once you go to book a first appointment, you'll be prompted to fill out a referral form to book that appointment. That form then kind of gets submitted and is reviewed by a clinician, one of the team. And in advance of that first appointment, you will receive some questionnaires. So those questionnaires asking about mental health, gender, of course, and maybe social communication. So some stuff around neurodevelopmental needs, and just to help us build up that picture so that we understand some of the needs that you may have in advance of ever having kind of first met you, so that when you come to that first appointment, we have a pretty good background already. So for those under the age of 18, we would, in that first appointment, the assessment appointment, we would meet with you and probably put a plan in place around what the assessment process would look like, who would need to be involved in that, parents, family. And so it tends to be for those under the age of 18 that there's a kind of an expectation of one appointment a month for 6 months. And while for those 18 plus, and that would probably be different, usually fewer, so maybe 2 or 3, but that's kind of based on the individual and depending on their needs. As I said, for those under 18, we would be including family, parents, and any of the kind of support networks, potentially liaising with schools, if there's any other mental health, can maybe a CAM service involved. While for those over 18, things are, I guess, a bit more individual focused. However, we do recognize that just because you turn 18 doesn't necessarily mean that you know, you might still be living at home, and there might be some family related things to consider. And so we, on a case-by-case basis, we can include potentially family members for some of those appointments if that's kind of deemed appropriate. And then I suppose we would, as I said, link with other professionals. We would pose questions, I suppose, in an age-appropriate way to explore some of a young person's kind of identity, what's brought them here. So I guess how we would talk to a 12-year-old would be quite different to how we talk to a 22-year-old. And so we'd adjust the way we talk, the kind of the level of the conversation, and I guess the speed of things accordingly. I guess essentially the aim is to arrive at a collaborative and shared decision with either the individual or the individual and the parents, in terms of developing a care plan of how best to meet the needs of that person, both gender and other potential needs that might be identified, whether again they might be mental health, other physical health needs that might be there, and then essentially produce a report summarizing those conversations and detailing that care plan that has been agreed from that assessment process. Yeah, I think that's it.
Thank you. And I guess if that doesn't make sense, or if there's any questions, then please pop it in the chat, and we're hoping to answer some questions at the end. I guess people will probably wonder why Gender Plus and why we're different to any others on the market. And I don't, if anyone's been reading any press, we're certainly hot in the press the last couple of days, commenting on our best practice. You might want to include that in your answer. But why would people choose Gender Plus over others on the market?
Good question. That's me again. Yeah, so I guess we are in Ireland, I guess particularly, we're the only independent gender identity service based in Ireland that is provided through a multidisciplinary team of mental health and medical clinicians. We meet regularly for MDT meetings to discuss and monitor the care of our patients along the pathway. We are each registered with our own professional bodies, and in England, our Hormone Clinic is registered with something called the Care Quality Commission, which regulate healthcare providers in England. And I know that's not necessarily a requirement in Ireland, but I guess I mentioned that to kind of offer some reassurance around the quality and oversight of the service that we are offering. It is regulated, and there is oversight of the service that we provide via the CQC. Collectively, the team have a great deal of experience of working with gender diverse young people and adults. So I guess high quality care from experienced clinicians, really.
Great. So hormones are always a hot topic, as is anything sort of medical. So I think we probably spend a bit of time looking at those questions. And Aidan, you're answering these so beautifully. So I'm going to go to you again. Where does the Hormone Clinic operate out of in Ireland?
So in Ireland, both our hormone and our psychological services are operating out of the same venue, the same place. So we have a room, a clinical room that we rent near Stillorgan Village in the south side of Dublin. For anyone who's familiar with the old Stillorgan Park Hotel, or the now Talbot Hotel, it's just next to that. So it's easy access to the M50 for those people traveling up. And so, that's where the Hormone Clinic takes place. Currently, we are offering one hormone clinic a month, and it would be a requirement that you attend the first appointment in person to give consent, but it's potential then for kind of any review appointments to be either, I guess you can choose whether it's in person or kind of via Zoom or that instead, really.
Great. Do you want to rest for a minute?
Please.
Shall I ask myself a question then? Because I think I'm probably best to answer this one. So do we follow an informed consent model? So yes, we do. And those of you that have ever gone for an operation or discussed any sort of medical treatment, you'll know that consent is important for anything that we do. And we follow informed consent models here at the Gender Plus Hormone Clinic. So what that means is we need to make sure that the individuals understand, obviously, the benefits to going on to hormone treatment and everything that entails, but also any risks. So even if they're quite low, we still need to talk them through. So just like if you were going through a general anesthetic, you know, everything would be spoken to you and you would sign the consent form. So we're quite passionate about it, and the consent form is quite robust. It's about 4 pages long. Lots of information to go through, which you'll go through when you meet the endocrinologist. And it's something that we're really proud of, and something that we developed over here in England. And actually our regulatory body did comment on how good it was. So we've further developed that and made it even better and even more robust. So we know that sometimes it can be a little bit frustrating for our patients to have to go through so much of a consent form, but we believe it's important to understand that everybody knows the benefits and the risks when starting on medical treatment. So, Claudia, you've just been quiet there in the background. Did you think I'd forgotten you?
I was wondering.
So, a question that I've got here is, what experience does the Gender Plus Hormone Clinic have?
Yeah, I think we do have a wealth of experience in this specific area of healthcare, and we've run similar clinics in the NHS for several years. And through that experience, we have, I think, learned what works, and also kind of also learned what could be improved. And we have listened to the feedback from gender diverse people and their families. And I guess the model at Gender Plus is building on the expertise, the experience, and the feedback we have received from gender diverse young people.
Thank you. Aidan, can we help those that are under 16? It's a good question.
Yeah, so I guess in terms of the psychosocial, so the more the psychological or mental health services that we offer, so doing assessments, support sessions, and whether that be around more traditional mental health therapies or potentially neurodevelopmental, autism or ADHD assessments and support, we can certainly provide those to those under the age of 16. Unfortunately, at the moment where we're at with our hormone clinic is that we're starting from the age of 16. As people would probably be very aware, this is a highly scrutinized area. And I guess as we kind of take our first steps into providing gender affirming hormone treatment, we kind of have taken the decision to start at the age of 16 in order to get ourselves up and running. And it feels like that's the kind of the best position we can take at the moment to reach the widest kind of population group that we can. That doesn't mean that we don't see value for those under the age of 16. And so we would certainly be able to do assessments and talk about hormone blocker treatment under the age of 16, but we wouldn't be able to prescribe that. I suppose that would need to be accessed at a different service if that was the case.
Thanks. So Claudia, can people use the Hormone Clinic as a standalone service, or do they have to go through the psychological service?
Yeah, I guess we are a fully integrated multidisciplinary service, and that offers the benefit of a comprehensive assessment with very strong links to the Hormone Clinic arm of the service. And I guess when a young person or adult goes through a medical transition, then the Hormone Clinic and endocrinology support is always available, as well as the psychosocial support is fully integrated, and that continues throughout a person's journey.
So what about if somebody has a diagnosis of gender incongruence? Can they have direct access to the Hormone Clinic?
Yeah, so if you have a diagnosis already, then of course we will take that into consideration. But anyone who wants to be referred to the Hormone Clinic first will meet with a psychosocial clinician from Gender Plus and carry out a full assessment. And we would, sorry, not a full assessment, carry out an assessment, but we of course take the previous assessment into account. And the clinician will review the previous diagnosis and, where indicated, make a referral to the Hormone Clinic.
Great, brilliant, thank you. So Aidan, what support is available for those with complex psychological needs?
Yeah, so in Dublin we have a clinical psychologist, Fabiola Neto. They're kind of living and working there. And I'm over doing kind of monthly clinics as well. So there's Fabiola there quite a lot, and I'm over in a bit as well, offering, I guess, assessment and support side of the service. We do have another arm to the service in terms of if someone has more complex mental health needs, or maybe requires a neurodevelopmental assessment, so autism or ADHD type assessments. The clinicians that offer that are London-based clinicians, and so I guess we'd need to consider whether that is the most appropriate thing for that patient to access. And I guess in theory they can access that. However, we also want to think with them about if there's another more local service that might be easier to access that there. And so if that was the case, then we would signpost people to local services. But we are able to access provided via our London team, but equally we know that that might not be ideal for everyone. But we do have a psychiatrist in London-based psychiatrist, and autism and ADHD pathways offered out there. And I guess part of the benefit of the way we work is that some of that can be done remotely. But as I said, that there will be discussion on a case-by-case basis about whether that was felt to be the most appropriate thing, or whether a more local service would be better offered. And then if that was the case, we would link you in with one really.
Great. So you've got the floor. So I don't know if I want to hand over to you if you want to ask us some questions that have come through.
Sure. That's my turn. So I think this one is for you, Paul. So I think these are the questions that were sent in beforehand. So yeah. So at what age does the Gender Plus Hormone Clinic prescribe estrogen, Paul?
Well, same with testosterone. We're clinically indicated from the age of 16 upwards.
Very good, very
Short
good.
and
And what
sweet.
age do Gender Plus Hormone Clinic prescribe hormone blockers? That's the question.
So we don't prescribe hormone blockers as a standalone service, and we know that they're safe and effective and internationally recognized by experts in the endocrine field. I guess one thing we need to move away from, we've been having this conversation, is that, the word puberty blockers. It's a medication and it's used for an array of things. I think for us, being in our junior phase of setting up the Hormone Clinic in the UK and in Ireland, the use of hormone blockers, unfortunately, is quite contentious. So for us as a service, we made the decision to work with 16 to 25-year-olds, and there isn't really a clinical indication as to why we would want to block puberty from the age of 16. Most young people have completed most of their puberty. So we do use hormone blockers alongside feminizing and masculinizing treatments to downregulate any natural production of hormones before we bring in the other hormones. But we don't use it as a puberty blocking method. Does that answer the question?
I think so. I think so.
Okay, good.
I think it was one thing you said there I might pick you up on. I think the age group that we work on with in terms of hormone provision in Ireland is 16 plus, isn't it? We see people of all ages, so we'll see kind of adults quite a bit older as well. Okay. I think this one is going to go to you, Claudia. You've got a couple here. How long is the waiting list, Claudia?
Well, I'm delighted to say we don't have a waiting list, so we can see people pretty quickly.
Good. Sound of that. And can you tell us how long the process normally takes?
Yeah, I think you probably covered that already as well. So for under 18s, it's approximately 6 appointments over 6 months, and for over 18s, it's about 2 to 3 appointments usually.
So here's someone asking, in Ireland, when I get a referral for hormones, what is the name of the local endocrinologist that I will be referred to? Paul, do you want to, you're part of the hormone pathway. Do you want to say who the local endocrinologist is in Ireland?
Yes, it is the lovely Dr. Tomos Ahern. And I'm pronouncing it right, so that's
guess you've got it right now.
Yeah.
That was part of the learning phase. Yeah, so Tomos is the endocrinologist that works with Gender Plus in Dublin. And is there a waiting time to see Tomos if after assessment? How quickly can one see Tomos?
Is that me? Yeah, there's no waiting time for Tomos. He has a clinic once a month, so I guess it depends on that sort of timeline. But there's no waiting list. But it's just important to point out that baseline bloods are required prior to an appointment. So I guess that's the waiting phase there, how quick those bloods can get done and the results to come back. But we don't have a wait to get into that clinic.
I'll give you another one, Paul. It's another hormone-related one. Will the endocrinologist give me the prescription after my first visit?
Do
you see the answer there?
No, I think you need to answer this because
I'm answering that. Sorry,
the Irish man. Yeah,
I'll answer. So, providing that there's an agreement to treat for treatment, yes, there will be electronic prescription issued. Either the clinics tend to happen on a Saturday, so it tends not to happen Saturday, probably Monday or Tuesday. The electronic prescription will be issued and sent to your local pharmacy. A copy will go to you and your GP as well. And so you would go down to your local pharmacy and they would have we have access to the health mail system that some of you will be familiar with. And so the prescription gets emailed directly to your local pharmacy. You go down and collect it there, really. So so pretty much within a few days of that hormone clinic appointment, you would expect to be able to collect your medication and start the process, really.
Aidan, talking about the pharmacy, there's another question. Will there be any difficulty getting a pharmacy in Ireland to fill the prescription?
That's a good question. So we're not. I should say we've started our Hormone Clinic in Dublin in November. We've not had any difficulties in our first few ones. I guess Tomás Ahern is a Irish registered doctor with the Medical Council of Ireland, and so there is no reason. I think other people in other services might get prescriptions from abroad, and that gets things that can make things a bit more tricky. But no, that hasn't been our experience so far, and isn't something we're envisaging being a problem.
That's great, thank you. I think the next question is for you, Paul. The person asked, how long will I have to wait for a referral for surgery after I start hormones?
So I guess this will depend on the type of surgery requested. If it's chest or facial surgery, then that can be done quite soon, usually around 6 months post hormones. If it's lower, so genital surgery, then most surgeons do require at least a year of being on hormone treatment and 2 years of a documented social role transition prior to surgery. But this, of course, very much depends on the surgeon that you go to or referred to.
Okay, great. And is it Aidan or someone else from Gender Plus that will provide the surgical referral? Someone wants to know.
Well, I think we like to work Aidan hard, don't we? So it is Aidan that provides the service for the Irish patients. Although in time, as we expand, we're hoping to have more clinicians that will be able to offer that service.
Okay. And Aidan, is it difficult getting a surgeon to carry out both top and bottom surgery? Someone wants to know.
So I guess we've got links. Predominantly, I've worked in the child service in the UK, but also adult service. So I guess most of my links are with UK-based surgeons, and there are others in Europe that will also do both surgeries and who accept referrals. Because we do recommend that people check with the individual surgeons, as they can vary greatly in terms of what they will or won't do. And so it's not always possible for us to stay kind of up to date with the criteria of each surgeon. And so I think places like Reddit and other forums can be quite good, where people kind of update information on what surgeons are doing what. It's not always, as I said, not always possible for us to be kind of absolutely up to date on each of the different criteria.
And are there any surgeries available in Ireland?
To the best of my knowledge, there is only one surgeon doing chest masculinization surgery in Ireland. I think through the Beacon, I'm not too sure, hospital. And so sadly, that means that most people have to leave the country in order to get gender affirming surgeries. And I know that's something that the HSE has been kind of told about and know about, but unfortunately, that's the kind of situation. So I know lots of people go to Europe to kind of access the different surgeries. I think Spain and Poland are places that people tend to go. So I do have experience of referring people to those places. So it just depends on what you're looking for, really, and how comfortable you are with the results that you're seeing, and of course attending a consultation in advance of the surgery, asking your questions there, gathering information to kind of help make an informed decision, really.
And following on from that, if someone goes abroad, is that covered by the VHI?
So VHI, one of the big kind of insurance providers in Ireland, I guess that would probably depend on the individual's plan. I guess there's different plans there, so I guess it would be best to seek clarification from the VHI. Really, I can't say for certain. I don't know.
Okay. And now to the last question that was sent in beforehand to you, Aidan, as well. Can you provide some advice on how best to balance presenting the information and supporting choice making with the impulsive nature of some individuals?
Thanks.
So it sounds like it's about decision making when someone maybe is a bit impulsive.
Yeah, and I guess that's obviously something that's really important. Some of these decisions are irreversible and life-changing. So I guess it can be helpful to view decision-making as a process made up of multiple conversations informed by different sources of information, so whether it's written or verbal, rather than as a kind of a single event. Having access to a variety of reference points can help the individual to process the information in different ways, and also to build a fuller picture. which will inform any questions that they might have. It should also allow the person to demonstrate that they understand the information that they've been given and that they have considered the pros and the cons of that decision, really. But I guess that would be something, that the assessor, the psychologist, the clinician, and before they even get to, say, the hormone clinic or the surgery, that's part of our role, is to facilitate that thinking process. And then that would happen again if they go to, say, whether it's a hormone clinic appointment or a surgical one. So they will have multiple times and multiple opportunities to think about these things. So it should negate any kind of impulsive decision making, I suppose.
Great.
Lots of questions have come through. So we'll try and work our way through them. And if there's any that we can't answer, we're going to try and compile answers later and have them on our website. So first one is, hello, my 17-year-old is getting hormone treatment from Gender GP for the last 12 months. They're interested in top surgery. What would be their options? Aidan, probably you for this one, I think.
Yeah, so I guess we, I guess we'll work with those approaching their 18th birthday to kind of think about surgical referrals. I'm guessing this might be around chest surgery or similar. And so we would certainly be open to meeting with that young person, having a couple of appointments to review how they're doing and talk through that information like I was referring to, and then if appropriate, kind of making any onward referrals to whichever chest surgeon or they are considering, really. I guess that would be with the view that wouldn't happen until they're 18, I suppose, just to be clear, that we would be willing to see you before your 18th birthday, but we wouldn't be supportive of someone having chest surgery prior to their 18th birthday, if that makes sense.
Yeah, thank you. Claudia, maybe one for you. Can the psychology appointments actually diagnose gender dysphoria?
Yeah, we certainly can. That's part of our work, especially if a young person or an adult gender diverse person wants to know whether they meet criteria for a diagnosis. And the other part of the work is if someone wants to access medical interventions, kind of working with the young person to assess readiness for medical interventions as well. So yeah, psychologists and psychosocial clinicians carry out an assessment for gender dysphoria.
Thank you. Somebody asked who prescribes the hormone treatment. I think we may have answered this, but that's Dr. Ahern, who is a consultant endocrinologist who is very experienced. Anything quite Irish specific, Aidan, I'm of course coming to you. Are prescription recognised and accepted by GPS and the wider HSE? Some people are finding it very difficult to get prescriptions filled in Irish pharmacies.
Yeah, so I think that might be related to a service provider that isn't issuing Irish prescriptions. And so I guess that's where we're perhaps different. We have a Irish registered medical consultant issuing those prescriptions. He issues, so in terms of the GnRH analogs, the kind of suppressant, hormone suppressant medication, which is a high-tech medication in Ireland. There's a scheme there, so he's able to issue those prescriptions as well as the sex hormones ones as well. And so yeah, there's been no difficulty. The first 3 or 4 months worth of clinics we've run, there's been no difficulty with our patients getting them filled, and so the pharmacies seem to be happy to, yeah, there's been no issue with the pharmacies, really.
Thanks. Someone's asking if they can come direct to us or that has to be via the GP. Yes, you can come direct to us.
It can be quite helpful for a GP to know, especially if we are hoping that they are involved in ongoing care.
Which then comes on to the next question. Do we need our own GP to be involved in hormone treatment? Yes.
So I think in Ireland, I guess the way it tends to happen, doesn't it, is that, I guess, yeah, especially if you're having these medications administered, having the GP aware of what you're doing, sounding them out, preparing them, I guess sometimes some GPs are a bit unsure about what this is about. And I know that's part of what we offer, isn't it, with the Hormone Clinic, that we'll kind of talk to GPs, try to answer any questions, offer them any training that they might need. And so I guess preparing them in advance doesn't always negate some kind of issues down the line, but usually kind of the more you kind of involve them and let them know about what's happening, then the more on board they are when something like hormone treatments happens.
Absolutely. Thank you. Just going through the questions. I've lost my place. Oh, here we are. A question wondering about ADHD and autism and what that has to do with transitioning. I don't know if that's something you feel you can talk to here. I think it's quite a big subject.
Yeah, I mean, I guess we carry out holistic assessment, and we think of a person in the context of their lives. And I guess neurodevelopmental issues might be important to pay attention to. I mean, what it specifically has to do with transitioning, I think it depends on the person. I mean, some people with ADHD, in terms of processing or making decisions, it can be, I don't want to generalize, but it can be impulsive. So you want to make sure that a person takes the time when they make really life-changing decisions. So we would pay attention to that. And similar with autism, I mean, there are different, I mean, sometimes it just means that we have to structure the sessions more, especially, and I'm using autistic because autistic people say that that's their preferred language. So autistic people might really benefit from knowing in advance what will be talked about and given lots of choice in terms of which topics to cover. And again, in terms of decision making, some autistic people, not all, may find it, they're really often very good at knowing all the effects and side effects, but sometimes find it a bit harder to project into the future. So you might really kind of break down how to think about the future and how kind of certain decisions, for example, about medical interventions might affect them longer term. So it depends really. I don't want to generalize because it depends really on the person in front of you and what they think would be useful in an assessment. And Aidan, did you want to add anything to that?
Just to say, I guess I agree with all that. I guess is that it's the kind of the occurrence or the rate of neurodevelopmental conditions within the kind of referrals of people to gender services is, I guess, quite high. So kind of 30-something%. Some studies even higher would kind of suggest that they either, someone may have autistic or traits of autism or an ADHD diagnosis. So it's quite a high proportion of people that come to gender services might have those additional needs. So we kind of, as a routine, as standard, would kind of consider those during our assessments.
Someone just wondering about, are there negatives to delaying medical treatment? Do all transgender people have to go on hormone treatment?
Do you want to say that, Paul, or what do you want me to? Or...
I think I'll let's go medical and then we'll go to psychology. I guess medical, if we're looking at the delay in hormone blocking and puberty blocking, then I guess what we're talking about is that the person is going through puberty that they may not be happy with. And of course, there's physical changes to the body that is irreversible. So in that respect, that might be perceived as a negative. In terms of when somebody starts on hormone treatment, when they start on that physically, and I'm talking about the biology, it doesn't matter when that is, but psychology wise, it's obviously very different. So I think it's probably more for you two to answer that one.
I guess it's to say that no one has to go on hormone treatment. You can identify how you hold any gender identity, and that shouldn't, no one has to then reflect that or kind of go down a certain treatment pathway because of that. Of course, there are many people who choose to because they feel a level of discomfort or distress related to their physical body, which is, I guess, part of where this might all come in, but that doesn't if someone doesn't access medical treatment, that doesn't invalidate their gender identity in any way, really. Yeah, I don't know if there's anything else you'd add to that, Claudia.
Yeah, I think it's about the individual and what works for them and it's in their best interest. And people do their gender in a whole diversity of ways. And some do that with medical interventions and others do that without medical interventions.
Thank you. I think the next question I think we probably answered about a transfer of care, in particular from gender GP. Would you be able to continue the care? I guess just to reiterate that we can take on a transfer of care, but there would need to be 1 or 2 appointments with Gender Plus before they come through to the Hormone Clinic. From our experience, we're not seeing there's evidence of all the blood tests that are required before going on to treatment. So it may be that we ask for evidence of that. And if there isn't evidence of that, then in some cases, somebody may have to come off treatment in order for us to take those tests. And we know that that's very difficult, and we'll talk you through why. But in order to safely prescribe a medication, we need to make sure that somebody is physically well. And a way to evidence that is by doing certain blood tests. So if those blood tests have been done, then absolutely there won't be a break in treatment. We can transfer straight across. Otherwise, there may need to be a short time off treatment in order for us to get those blood tests. I think I don't know. Do you want you to want to take over the questions? I feel like I'm hogging here.
Grand. Yeah. Do you want? Okay. I think Claudia's coughing, so I'll jump in. Can assessment appointments need to be kind of a month apart, or can they be done weekly or fortnightly? As spoken of earlier. What do you think, Claudia?
Well, I think there's a bit of flexibility, but it's good if they're spaced out, so it gives the people we work with and their families time to just process things. And I think overall it's quite good if the overall assessment takes a few months, because these are big, potentially important decisions that can affect a person for the rest of their lives.
Yeah. And then this is another one kind of referring to the Hormone Clinic and perhaps some of the costings. So what does the process of attending ongoing hormone service entail? How frequent are the appointments that patients need to attend, and what are the costings of that? I think that's they reference some information on our website. I guess what might be helpful to say is that there's actually 2 websites. There's www.genderplus.com, and then for the Hormone Clinic, there's www.genderplushormoneclinic.com. And in there's an FAQs for the Hormone Clinic that gives all the breakdowns for the costings in the pounds for the UK one and euros for the Irish one. So maybe that might be because we do a subscription-based process, and it breaks down there what the fees are. I think it's €95 a month, and that gets you ongoing. That includes your hormone reviews, your prescriptions. And it also would include the psychology reviews as well. So reviews happening at 6 monthly intervals. So the typical pathway being kind of a 2-year pathway, with the idea that at the end of the 2 years you'd be kind of on a fully established dose and discharged back to your GP to then continue the care and prescribing and overseeing it. That after initial appointment, you would have kind of 6 monthly reviews. So at month 6, 12, 18, and then at 24 being the last one. So that would be hormone endocrine reviews, but also the psychosocial reviews at those intervals as well, really. Yeah, I think that answers the question. I think I was going to give that to you, Paul, but then I just couldn't help myself.
You answered it beautifully. There's a few, I'm just going to, because I know we've got 10 minutes, so there's a few that's specific to me, so I'll just take them and then hand them back over to you. So a question about blood tests. Can a GP take bloods, or does this have to be done at the hospital? Yes, we would ask for your GP to undertake those blood tests. And so far, as Aidan mentioned, we've ran quite a few clinics now, and we're not having any issues with that being done. Are there regular blood tests required while somebody's on hormones? And yes, that's done 6 monthly. Sometimes it might be done 3 monthly if there's a clinical indication, but usually it's every 6 months during that 2-year period that you're with us. I thought I saw another one on hormones, but maybe not. Oh, can estradiol valerate be prescribed in an injectable form? No, we don't. That isn't available. That's not something that we prescribe. It's a gel that's used. Yeah, that's it. I just saw a few specific to the Hormone Clinic. So I think the next one is about somebody who's got an autism diagnosis, and they've heard it can slow down access to hormones. So I'll hand that over to you guys.
Yeah. I guess I can say on that one, you can add in, Claudia. Not necessarily. No, I mean, I guess it's about case by case basis. If someone's life is complicated, and we need to kind of spend more time to kind of explore that, whether they have autism or not, kind of as secondary. But actually, an autism diagnosis on its own doesn't necessarily tell us very much. Actually, we're more interested in the individual, and of course, if there are other needs related to their autism, then of course we try to adapt and be flexible and kind of meet those needs, really. But it doesn't tell us whether someone should or shouldn't go forward for hormone treatment, for example. Okay.
Someone I knew there was another one in there. It was about what happens when there are negative side effects to hormones. So with any medication, there is, as I mentioned before, which is what we counsel somebody when we take consent. There's of course risks. There's not one medication or medical option out there that doesn't have some element of risk, but they are very low. What would happen is that you'd be under the care of a medical team. Part of the subscription model is you have direct access to the medical team. So we'll be able to, it's very difficult to answer, but we'll be able to work with the individual and come up with a plan of action. It's incredibly rare, but you are looked after by the medical team whilst you're with the Hormone Clinic.
Mm. There are a few surgery questions as well. So is it possible to get surgery without taking any hormones beforehand?
It would depend on your particular circumstances on which surgery. I know there are potentially people who identify as non-binary who might be interested in chest masculinization surgery, obviously as an adult, and that would be reasonably common. They wouldn't necessarily have to be on hormones, but that would be reasonably common. We probably want two clinicians to assess them to agree. In that sort of circumstance, that tends to be the approach that's taken, and when someone isn't on hormones first. But I think if it's an adult considering lower surgery, then I don't think any surgeon that I know of would do that surgery without someone going on hormones. But yeah, chest surgery I think is reasonably kind of commonplace to do that without hormones.
And does the HSE cover surgery under the surgery abroad scheme? Do you know?
That's more of a treatment abroad scheme. They're hard. It's hard. I can't speak for them, so it's hard to say what they will and they won't cover. We'll have to leave that as I'm not entirely sure. I would say probably unlikely because we're not a public health service and their position as a public health provider, but I have to go away and check that, and probably have to liaise with the treatment abroad scheme about that, really.
There's a question about a recommendation to support a prepubescent younger child, so aged 11, who is requesting to initiate the transition process, hormone blockers, etc., to prevent breast development. Is the first step organizing specialist psychology support to discuss possible future options?
I mean, I think it would be helpful to do so. I think obviously there's a couple of dilemmas in there in terms of age and development, and also the implications of different medications that are being kind of talked about there in terms of someone's long-term outcomes, I suppose. So certainly a tricky situation, but yeah, I would think that would be a good place to start to kind of meet and explore and to understand a little bit more about the needs that might be there and how best to manage that, really.
And I guess it's important to say that we would offer any medical interventions from age 16 and not under 16. Yeah. Good.
I think on that, I think there's a question coming. It probably have to be the last one. And it follows on from there. For a young teen starting with the assessment sessions now, what is the path once they get a diagnosis, as they'll need to wait a few years if they want to get hormone treatment? Do they just wait, or is there any other support that they can get?
Well, I guess, well, I don't know. I'll try and answer that one. So I guess someone's needs may change over time. So I guess the conducting an assessment, trying to identify any areas of need that might be kind of, I guess, the non-medical, whether it's social, psychological, any other aspects that might be needing support with, I guess would be what we're doing. Sometimes explore, I guess sometimes having a space to explore and make sense of something that might feel quite distressing and overwhelming in and of itself can reduce and alleviate a level of gender dysphoria or distress. And so we do think that the assessment is an intervention in and of itself, and can be a helpful process for both the young person, families, parents, understanding kind of and feeling understood by parents and social group as well can help someone as well kind of reduce their distress too. So I guess that in an ongoing way would be what we could offer under the age of 16, really.
Thank you. I think we've got a couple of minutes left, so we should probably draw it to a close. I think we've answered quite a lot of questions there. As Aidan mentioned, we've got our website, genderplus.com and genderplushormoneclinic.com, and we try to update our FAQs on there. If any questions have come through and we've not been able to answer them, we will try and look at those and answer them for you either on the website, or we'll find another way of communicating them to yourselves. And we also have our social media, our Instagram accounts, that's GenderPlusUKIRL, and we try to put updates on there as they come through. So we hope that you've found that useful, and it's been our pleasure to be here this evening. Thank you.
Thanks for having us.
Thank you very much. Bye-bye.
Bye.